Knee pain from osteoarthritis is a massive problem. So today, let's look at a new procedure called GAE.
Millions of people suffer from this. Now, a procedure called GAE is emerging as a potential new option.
So what exactly is GAE? Well, it's not open surgery. It actually targets the source of the pain directly.
It's really for folks who've tried everything else, exercise, meds, even painful injections, and nothing's worked.
Okay, so the whole theory here targets something called neovessels. Think of them as bad blood vessels causing pain.
These little vessels are basically fueling the fire of inflammation. GAE's job? To cut off their blood supply.
The procedure itself is super precise. A tiny catheter finds these vessels and blocks them with microscopic particles.
And wow, check this out. You can see the before on the left and then the after. What a difference.
Early on, the hype was real. We're talking more than 30 different studies were done on this.
And the results looked pretty amazing, with pain scores dropping significantly for most patients.
Patients were reporting these huge improvements, and because of it, GAE just exploded in popularity.
But you gotta ask, how much of this was a real effect? And how much was just the placebo effect?
To figure that out, you need the gold standard of medical research, a randomized controlled trial.
So 3 major trials were published, and this is where it gets really interesting. The results were mixed.
In fact, 2 of the big trials found that patients got just as much better with a sham procedure.
So where does that leave us? Well, GAE does seem safe, and it might work best for milder cases of arthritis.
This really seems to be the key point. Picking the right patient matters. Less damage seems to mean better results.
So, is GAE a game changer? The jury's still out. The next round of trials will hopefully give us an answer.